One of the very interesting repertories and my favorite repertory is BBCR. It is like both Kent and Bonninghausen reborn as Dr. Boga. So beautifully, one man's brain has produced an amalgamation of two great repertories. And very interesting chapter in BBCR is compound fevers. Fever beginning with chill, beginning with heat, beginning with shivering, and beginning with sweat. It's a beautiful play of ODT, of febrile stages. What stage precedes the other? What stage follows the other? How does it end? It can be very erratic, and all sort of permutations and combinations are used over here. In fact, and we have found some very peculiar rubrics over here, like there is heat internally, but externally there is coldness to touch. So this also is a very peculiar rubric in prescribing, where there is internal heat but external coldness. Then various parts of the face, or the head, or any part of the body, there can be heat in some parts, then can be coldness in some parts. So at the same time, contradictory symptoms are present in the body. So this is also to be seen. And I've used this many a times, at least in one of the rubrics, that how is the compound fever coordinating with the stages, like how is it comprised of, that is heat, chill, and sweat, and only coldness also, or only shivering also can be there. Then another chapter which is very useful is pathological types, which is again found in fever. So whenever you have a patient who comes with either gastric fever, or, or fever due to uh, catarrhal type, or different types of fever, bilious fever, dentitional fever, hectic fever, you can use this as a rubric directly from the pathological types. Once you have configured that this is a pathological type, and you're sure short about the diagnosis. So this chapter is also used very often, pathological types and compound fevers. Of course, the chill and sweat and other uh, chapters are also used, but you can at least safely have two rubrics from these both chapters to form your totality. So BBCR, one of my favorite repertories, especially pathological types and compound fevers in febrile conditions.